King Charles cancer battle continuing into 2025. Oncologist explains why this reveals disease's sinister side. We were told the king's cancer was early and potentially curable, but the latest announcement from the palace reveals a more sinister side to his diagnosis. Although it has not been officially announced precisely what cancer King Charles has been diagnosed with, it is very likely to be bladder cancer. The announcement that treatment is extending well into 2025 tells us more about the precise type he has, with some concern. From the course of events early in 2024, it appeared that his bladder cancer was picked up by chance, after the biopsy of his prostate for a separate condition called benign prostatic hyperplasia, BPH. This was very fortunate, as his bladder cancer could have grown for many months without being noticed until a more advanced stage. The usual first sign of bladder cancer is blood in the urine, hematuria. It is well established that the earlier the cancers are picked, the better the prognosis, especially whether the cancer has grown into the muscle bladder wall. The treatments for bladder cancers which have or have not spread into the muscle wall are significantly different. Whatever the treatment pathway, the urologist will be keeping an eye on the bladder via flexible cystoscopy at regular intervals to spot any recurrence. These do not involve a general anesthetic but does cause some inconvenient and sometimes troublesome cystitis symptoms for a few days. On top of medical and surgical treatments, there is some evidence for dietary and lifestyle strategies which can also help speed up recovery from these treatments and reduce the risk of relapse. Fortunately, the king is fit for his age and has a good diet, eating an avocado every day, is a non-smoker, is not overweight, and is physically active. As well as these, the factors which help the prognosis include quitting smoking, if relevant, improving gut health, stopping late-night snacking and high-processed sugar intake, ensuring adequate vitamin D levels. Avoiding dietary and environmental chemicals, exercising at least 3 hours a week, trying to get a good night's sleep, avoiding ultra-processed foods, and boosting the intake of phytochemical-rich foods. These prolonged treatments will be uncomfortable for King Charles and will have an impact on the practicalities of royal duties, but fortunately the prognosis remains good.